Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Padma Shri Dr. C.R. Chandrasekhar. He retired as a medical superintendent of prestigious NIMHANS, and after retirement he has continued free consultations and counseling for the needy people, and also he is a prolific writer who has written lots of books on the mental health to bring the awareness among the public. Today, he is going to tell us about how important it is to have a disciplined eating habit. If the eating habit, there is an alteration, what happens and how it has to be treated, he is going to tell us. So please welcome, sir. Namaskar.
Namaste, namaste. So food is very essential for all of us to survive. Without food, we can't live for more than a couple of days. We become totally weak and we may die also because we don't take water, we don't take nutrients, we may die also. So food intake is a natural activity, primary need of both human beings and all animals and birds.
Yes.
But eating should be in a disciplined way. So morning we take breakfast, lunch we take at about 1:30 or 2 o'clock, then dinner we take at 8 o'clock, 9 o'clock. But nowadays, people are not following any discipline. They take food whenever they want, all through 24 hours, anytime, anywhere, and they eat
and
lot
even
of...
at night, they continue eat, sir. Even at night,
midnight.
doing the party and eating at night,
Yeah.
or get up from the sleep and open the fridge and eat.
Or they keep all these dry fruits and everything near to them, and they keep on munching. They keep on seeing a movie, keep on munching. They keep on reading and keep on eating. My friend used to bring 2 liters of coffee or chai and keep on drinking while they are doing combined study. Memory so please, otherwise either you will be underweight. Now we see about among adolescent boys and girls, 25% of adolescent boys and girls are underweight. And 25% or 30% or more than that, they become overweight.
Obese. They are obese.
Obesity can lead to a lot of diseases like diabetes, hypertension, and so on. And undernutrition also lead to a lot of infections and other malnourishment.
Immunity is very, very low.
Immunity is very low. And then we suffer from various deficiencies, vitamin B12 deficiency, vitamin A deficiency, protein deficiency, and so on. So there are certain mental conditions where the appetite or need to take food is disturbed. And all of us know that need to take food is not in the stomach. People think that the stomach empty, we eat. No.
Yeah, no.
We take food because of instruction given by the food center in the brain, what we call appetite center. And also next one is the sleeping center. They are together in the limbic system of the brain. So the appetite center will open and say, take food. And then it will say, it's enough. So this center is not trained properly from childhood, and many parents overfeed the children because of love and affection. They pressure the child, eat more, eat more, eat more, or eat only this, eat only that, and child enjoys this type of prompting by the parents and learns to eat a lot,
Okay.
So depression and anxiety are the most common mental disorders, lead to decreased appetite. In depression, you don't feel like eating. You want to give them the best food, most tasty food. You say, no, sir, I don't want to eat, sir. No appetite. It doesn't taste well. And he starves. Whereas mania is a condition, a mental disorder, where they eat more and ask others to eat more and join them in eating. He says, I will pay the bill. You eat whatever you want. And also in parties and in various get-togethers, youngsters eat a lot. And there are 2 conditions, 3 conditions which are called eating disorders. One is anorexia nervosa, where the person refuses to eat, even to drink water. Totally will start losing weight, become thin and skin and bone, and then also will say, I will not eat.
That famous singer Celine Dion, now she has become so thin, almost like a skeleton. It
Yeah.
is terrible. The
Terrible.
celebrities, yeah.
Celebrities. And actually, our center, some girls are brought with, they are 20 years, 22 years old, but weighing only 30 kgs, 33 kgs, and refusing to eat. Mothers weep in front of us, sir. Eno tinnala, sir. She doesn't take anything. Look at her, how thin she is, but she doesn't want to take proper food. So, anorexia nervosa, we say it's a reflection of underlying depression or underlying what you call body uh, phobia. They think that my body is okay. If I eat 1 gram of rice, my body will increase weight by 1 kg. And even though some girls say, sir, they refuse to eat water, take water also. You say, if I take water, water is heavy and my weight increase. I don't want to put on weight. They refuse and
No,
they
many
become
people,
weight.
they think that drinking milk will put on weight.
But here, water, in adolescence, water also, they refuse to eat,
Okay.
and we have to hospitalize them and then give IV fluids, give nutrients, vitamin supplements, then take them for therapy. In therapy, we use what you call behavior therapy. We coax the person to change the view on the food. See, this food is necessary for your cells to work. Otherwise, your brain cells will die, your heart cells will not function, and you are inviting death. Would you like to live or would you like to die? Also, I want to live, sir. I don't want to die. So, life instinct will be there, but they refuse to eat. So, we what we call behavior therapy or find out what is the cause for their depression. Usually, many of them will report bad childhood, no love and affection from parents, and no attention. And they think that they were neglected. Their siblings were treated well by the parents, or they were neglected by the teachers, too much academic pressure. So, all these psychological issues can spread anorexia. And bulimia is the opposite. Bulimia is overeating. Overeating, they keep on eating, swallowing, and within 1 or 2 months, they put on 10 kg, 20, 30 kgs, and they don't bother. They don't bother. And third one is pica. Pica is again, mental disorder
Abnormal.
where the person eats non-edible things, like raw rice, raw wheat, raw grains, or they eat paper, they eat pencil, they eat anything or wood and anything. They keep on chewing and eating, and it is so dangerous because they damage their stomach and they don't want to eat other things. And the pica is seen both in children, especially children, and also in pregnant women. ಬೈಗೆ ತಿನ್ಬೇಕು ಅಂತ ಅನ್ಸುತ್ತೆ. I feel like eating mud, eating raw mango or raw tamarind and so on. So pica is again a mental disorder arising out of either anxiety, because when a lady becomes pregnant, she is anxious whether she'll give birth to a healthy child or whether it will be very difficult and she may die also, because the olden days many people who die during pregnancy or during delivery or postpartum complications, and this fear operates and they say that it is the cause of pica. And children again, bad childhood, bad experience, anxiety, depression, academic pressures, and they enjoy eating non-edible things to keep them comfortable. So please identify, though they are not very common diseases, but not rare diseases, anorexia nervosa, bulimia, and pica. And also when a person changes food habit, and now there are ample opportunities for people to eat more, go to any party, they serve you 20 sweets or 20 different items, pressurize you, and one of the way to enjoy life is eating. So we have to cut down this unwanted desire to eat.
They are in fact living for eating only, so they keep on eating. Yes.
Yeah. In Kannada, ಬದುಕುವುದಕ್ಕಾಗಿ ತಿನ್ನಬೇಕೆಂದ ತಿನ್ನುವುದಕ್ಕಾಗಿ ಬದುಕಬಾರದು. You should eat to live, not to live to eat. So I request all people to follow discipline and select food items. Don't select the high calorie diet and take more fruits and vegetables.
And that too, the junk food with the taste enhancers and the chemical colors, they all should be avoided.
Because tongue dictates you. Your brain doesn't dictate, but tongue dictates you to eat more spicy food or oily food or other junk foods. and we should follow to keep ourselves healthy and happy. We should be very careful in eating habits.
Yeah. Eat lots of vegetables, fruits, and take timely food. It is not the so as far as possible, eat less and then drink some more fluid and then keep the other part empty. So less you eat and more active you are, the better it is. So
That's why
what are the treatments, sir, for these diseases, disorders?
one is antidepressant drugs to elevate the level of dopamine in the brain and to elevate the level of serotonin in the brain, because low dopamine, low serotonin reduce your appetite.
Okay.
And more dopamine will make you to eat more.
Okay.
Because you want to enjoy more. And so if you eat, dopamine boom. Like if you take alcohol, if you like taking more and more alcohol, similarly, food becomes addictive. There are many people who get addicted to food addiction. Food addiction.
Okay.
So one is use antidepressant drugs to increase the level of dopamine and serotonin, or if it's more, then use tranquilizers to reduce the dopamine level, serotonin level, so that you eat in a balanced way, not overeating or undereating. And that's what WHO says. After 60, like you and me, should eat less, talk more, and work more.
And laugh more.
Laugh more.
That is also very important. To be happy is also very important. And contented.
So wherever you go there, eat less, talk more, work more, and then smile more or laugh more.
Yes.
And don't worry about anything. And try to be happy
and sleep well. And sleep well.
Sleep well until the last day of your life. Because we come to earth as a guest, we come, and we have to go one day. Nobody can stay here for long time. So this is what we should do. So food is essential, but controlled eating is what is required for
the
keeping
discipline, the quantity and the quality and the timing, all should be very disciplined, and that's very important. So thank you very much for telling about the food, eating disorders, and how to avoid and how to get treatment. And once they get anxiety and depression, better to come for the counseling before it is too late and they become like a mental wreck. So thank you very much, sir. Thank you.
Thank you very much.